You wake up in the morning, and before you even get out of bed, you're already tired. You shave, you have your coffee, and you look at the clock. It's still 9 in the morning, and your legs feel as heavy as if you'd walked a marathon. In the afternoon, after lunch, comes the blackout. You sit down for a moment in the armchair to rest, and you sleep an hour without realizing. You wake up dazed, with that cotton-headed feeling, forgetting the names of people you've known for 20 years. And when you finally go to your doctor to tell him you've been like this for 2, 3 years, he orders some basic blood work, looks at you quickly, and says, "Everything is normal, ma'am. It's just age-related fatigue. Rest more, walk more, drink some tea." You leave the office with a forced smile, but inside, you know this isn't normal, that something's wrong, that you weren't like this at 50. If you're over 60 and this scene feels familiar, stick with me for the next few minutes. Because what I'm about to tell you is, in my opinion, the most underdiagnosed topic in geriatric medicine today. And the solution is a tablet so small it fits under your tongue. I'm Dr. Kevin Vries. Over more than 15 years caring for patients over 60 with chronic fatigue, I've seen something repeat so often in my office that it's become almost a pattern. People who take antidepressants thinking it's depression. People who take iron thinking it's anemia. People who've been on a generic multivitamin for 5 years with no effect at all. People who switch to 3 coffees a day to get through the day, push their blood pressure up, and still stay exhausted. And the worst, many of these people have a normal blood test because the wrong test was ordered and the reference value used for this age has been outdated for 30 years. There's a specific vitamin, dirt cheap, that science confirms as the most frequently deficient nutrient in people over 60. And most doctors in a 5-minute appointment don't even test it properly. Today, I'm going to explain it to you exactly. The name of that vitamin is B12, also called cobalamin. And here's the figure that might surprise you. Solid studies published in journals like the American Journal of Clinical Nutrition and the New England Journal of Medicine show that between 30 and 40% of people over 60 have some level of B12 deficiency. It's not rare, it's not exceptional. It's a third of the population in this age group. And the worst part is that this deficiency masquerades as what we call normal aging. Chronic fatigue, age. Forgetfulness, mixing up words, trouble concentrating, age. Tingling and numbness in feet or hands, circulation. Sadness for no reason, easy crying, loss of interest in things, age-related depression. Worsening balance, almost falling when you stand up, just being old. Burning tongue or smooth-looking tongue, stick with me here, this matters. All of this can have the same common root, vitamin B12 deficiency. And the reason this deficiency explodes precisely at this age is mechanical, not mystical. As we age, 3 things happen at the same time in our stomach. First, hydrochloric acid production drops a lot, a condition called achlorhydria, present in 20 to 30% of older adults. Without enough acid, B12 from meat and eggs isn't released properly from the food. Second, production of a protein called intrinsic factor, which is mandatory for B12 absorption in the gut, drops alongside it. And third, medications common at this age, especially omeprazole and pantoprazole for reflux and metformin for diabetes, further deplete B12 absorption capacity. Meaning, you can be eating steak, liver, eggs every day and still be in growing deficiency because your digestive system can no longer extract the vitamin from the food. It's a perfect storm. And the cruelest symptom is precisely the one that steals your energy, your memory, and your mood. So what does most people do when they start feeling chronic fatigue? They go to their family doctor, describe it, and walk out with a prescription for an antidepressant, usually sertraline or fluoxetine. Or they get a prescription for iron because the doctor assumed it was anemia. Or they buy a drugstore multivitamin, the kind with 27 vitamins and minerals together. And all 3 paths have the same problem. Either they don't fix the cause, or they fix it badly. An antidepressant in someone with low B12 may improve mood superficially, but the deficiency keeps advancing underneath, attacking the nervous system. Iron for someone without iron deficiency anemia overloads the liver and gut with no benefit. And generic multivitamins do contain B12, but in 2 problematic forms. A dose too small to correct an established deficiency, and in the form called Cyanocobalamin, which is the cheapest synthetic form, and which has to pass through the liver to be converted to the active form. In older adults, that conversion is precisely the step that's compromised, meaning you take the B12 from your multivitamin every single day, and your body can't activate most of it. Taking a medication that masks the symptom without fixing the cause is like covering the warning light on the car's dashboard with black tape. The problem keeps growing underneath. And the worst, in B12's case, is that prolonged deficiency starts damaging the nervous system irreversibly in some cases. Hence the tingling that doesn't go away, the loss of balance, and in severe cases, dementia mistakenly attributed to Alzheimer's. Here's a detail that almost nobody picks up on. Vitamin B12 isn't just a vitamin for anemia like many people learn. It's the electrician of your body. Picture it this way. Imagine your cells as small power plants with a factory inside called a mitochondrion. The mitochondrion takes the glucose and fat you eat and converts them into energy, into that cellular fuel called ATP. It's ATP that makes your heart beat, your muscle contract, your brain think. But for the mitochondrion to work well, the cell needs cobalt and a specific cofactor that only B12 can carry. Without enough active B12, your mitochondria produce energy in slow motion. It's like having a giant hydroelectric plant with the gate half closed. The water is there, the generator is there, but the flow is insufficient. Result: deep fatigue that doesn't go away with coffee, with a nap, or with a restful weekend. But it's not just energy. B12 is also mandatory for producing myelin, which is the protective sheath around your nerves. Without enough myelin, electrical impulses travel slower and with glitches, hence the tingling, the numbness, the bad balance. And it's also a cofactor in the production of neurotransmitters like serotonin and dopamine, which regulate mood, sleep, and motivation. Meaning, B12 deficiency leaves you tired, forgetful, tingling, and sad all at the same time. It's not coincidence, it's chemistry. And the knot is chemical, and the solution is also chemical. Now comes the part that matters: how to actually fix this. And here's the first important point. Not just any B12 will do. There are 3 main forms on the market, and the difference between them decides whether you'll get results or not. The first form is Cyanocobalamin, the most common synthetic B12. It's cheap, it's what comes in almost every multivitamin and almost every injection a doctor prescribes. The problem is, it's an inactive form. To work, it has to be converted in the liver into methylcobalamin or adenylcobalamin. In a healthy young adult, this conversion works reasonably well. In someone over 60 with reduced liver function and a genetic deficiency in an enzyme called MTHFR, in up to 30% of the population, this conversion is the bottleneck. The second form is hydroxocobalamin, intermediate, used in some injections. And the third form is methylcobalamin, stick with this name, which is the active, bioavailable form, ready for the body to use immediately, with no liver conversion needed. Studies published in journals like Annals of Pharmacotherapy and Nutrients have shown that methylcobalamin is better retained in tissues, crosses the blood-brain barrier more easily, meaning it reaches the brain more readily, and is more effective at reversing neurological symptoms like tingling and cognitive loss in older adults. And the second point that changes everything. Not every route of administration works. A traditional swallow tablet, what we call the regular oral route, depends again on the stomach and intestine, the 2 systems that are precisely compromised in older adults. The elegant solution is the sublingual route. You place the tablet under your tongue. It dissolves in 3 to 5 minutes, and the B12 is absorbed directly through the veins of the mouth, going straight to circulation without passing through the stomach. Total bypass of the digestive problem. Another option is the oral spray. For severe deficiencies with neurological symptoms, doctors still prescribe an injection, which is the fastest form. But for correction and maintenance, sublingual methylcobalamin in adequate dose is the modern gold standard. Before I explain exactly how to take it, do me a quick favor. If this video is helping you understand something nobody explained well to you before, click the subscribe button down below. That's what lets me keep bringing serious, science-based information without pushing things that don't work. Subscribing is free and helps me a ton to reach more people who need to hear this. You can rewind the video now, because what's coming next is the practical part that can change your energy in the first 3 weeks of use. Let's get to practice. The recommended dose of sublingual methylcobalamin for an adult over 60 with chronic fatigue or suspected deficiency is 1,000 micrograms per day, every day, on an empty stomach in the morning. For those with a confirmed deficiency on blood work, some protocols go up to 2,000 or even 5,000 micrograms a day for the first 4 weeks, then drop back to 1,000 for maintenance. Pay attention to this point. Although the dose seems huge, 1,000 micrograms is 1,000 times the old recommended daily dose. B12 is one of the safest vitamins out there. There's no known toxicity, even at high doses. The excess is simply eliminated in the urine. How to take it? Dissolve the tablet under your tongue on an empty stomach, ideally 30 minutes before breakfast. Don't swallow, don't chew, don't take with water. The trick is to let it melt under the tongue, 3 to 5 minutes. You'll taste a slight sweetness or cherry flavor, depending on the brand. You can also use the sublingual spray, which is equally effective. Important, don't take it with coffee, because caffeine speeds up the passage and reduces sublingual absorption. Wait about 20 minutes after the tablet dissolves, then you can have your coffee normally. I had a patient, a 72-year-old woman I treated, a retired teacher, with chronic fatigue for 5 years. She was already on sertraline, prescribed by another doctor who thought it was depression, and on fluoxetine before that. She'd nearly given up the water aerobics class she loved because she didn't have the energy to get into the pool anymore. I ordered the right tests: homocysteine, methylmalonic acid, and serum B12 with updated reference value. And she came back clearly deficient. She started sublingual methylcobalamin at 2,000 micrograms on empty stomach every day, along with folate in another active form. In 3 weeks, she called me herself. "Doctor, I can't believe it. I'm back at water aerobics, and I'm even doing the Zumba class I had quit." In 6 weeks, she was able to taper the antidepressant in coordination with her psychiatrist. I see this often in my practice. It's not magic. It's biochemistry corrected. The effect tends to appear between weeks 3 and 6. Neurological symptoms like tingling can take a bit longer, 2 to 3 months, and in severe cases, don't fully reverse. Hence the importance of not letting it drag on. And to amplify the effect, there's what I call the multiplier trio. Methylcobalamin alone already works very well, but if you want the full result, add 2 specific allies. First ally, folate, also called B9, in the active form called methylfolate or 5-MTHF, at 400 to 800 micrograms a day. Note, this is not folic acid, which is the synthetic form and has the same problem as cyanocobalamin. You want the active form methylfolate. B12 and folate work in pairs in what's called the methylation cycle, which regulates the expression of hundreds of genes. Without enough folate, B12 alone can't lower homocysteine, which is a molecule toxic to blood vessels and to neurons. Second ally, active vitamin B6, also called P5P, at 25 to 50 milligrams a day. B6 closes the triangle with B12 and folate, allowing the full cycle. This trio, B12, B9, B6, all in active forms, is the biochemical foundation of cellular energy and neurological health for anyone over 60. And the bonus, add vitamin D3 at around 2,000 international units a day, which regulates the immune system and calcium absorption in parallel. When you correct a years-old B12 deficiency, you don't just improve fatigue, you also drastically reduce homocysteine in the blood, which is an independent risk factor for heart attack, stroke, and dementia. Improve memory and concentration. Some studies show partial reversal of mild cognitive decline in 3 to 6 months. Reduce tingling and numbness. Improve mouth, tongue, and skin health. Stabilize mood, and reduce depressive symptoms in those who are deficient. And increase insulin sensitivity in diabetics on long-term metformin. It's not one thing, it's a system. It's not Y, it's X. It's not a vitamin for fatigue. It's the missing cofactor for half of our biochemistry to work properly past 60. Now some important warnings, because I take responsibility when I'm talking to you. Vitamin B12 is an extremely safe supplement. Even at very high doses, no known toxicity. But there are 3 situations where you need special care. First, severe deficiency with advanced neurological symptoms. If you have tingling that's been going for more than 6 months, very poor balance, or suspicion of dementia, sublingual supplementation alone may not be enough. Find a doctor to assess the need for an intramuscular injection in the first weeks. The injection corrects faster, and then you maintain with sublingual. Second, isolated folate supplementation without B12. Be careful with this. If you take high-dose folate without B12, folate can mask the B12 deficiency on a CBC blood test, meaning your anemia disappears on the test, but the neurological damage keeps advancing. That's why I always recommend the trio. Third, if you have an active history of cancer, some doctors prefer caution with high B12 and folate supplementation, because these vitamins activate the methylation cycle, which is also used by tumor cells. It's not an absolute prohibition, but talk to your oncologist. For everyone, ideally before you start, get at least 3 tests done: serum B12 with updated reference value, above 400 picograms per milliliter, homocysteine, ideally below 9, and methylmalonic acid, if possible. I left a link in the description below to a quality-sourced sublingual methylcobalamin with adequate dose, no unnecessary additives. If you'd like to take a look, just click below the video. Look, I wanted to close this video by telling you something important. Chronic fatigue at 65 isn't destiny. Forgetting your grandchild's name isn't destiny. Tingling in your foot isn't destiny. Sadness for no reason isn't destiny. All of this can be, and in more than a third of cases is, deficiency of a dirt-cheap vitamin that costs less than a coffee a day to fix. And the worst part is the resigned look I see in patients at their first appointment. Doctor, it's my age. It's just how it is. There is. In 3 weeks, with the right methylcobalamin at the right dose, most people who are deficient feel a clear difference. In 3 months, many go back to doing things they'd given up. I've seen grandmothers go back to dancing, retired teachers back to the library, business owners back to their hour-long morning walk. Vitality at 70 isn't a luxury, it's a right. If this video opened your eyes, do 3 things for me. First, tell me down in the comments, do you feel chronically tired? For how long? Have you ever had your B12 levels checked? I read every comment, and it helps me make more videos about what you actually need. Second, if you're not subscribed to the channel yet, click that red button down below. Third, send this video to someone in your family or a friend you know has been dragging an unexplained exhaustion for years. It might be the most useful thing you do for that person all week. I'm Dr. Kevin Vries, and as I always say at the end of every video, take good care of yourself.